بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. Jazakumullah to all of our volunteers who have, mashallah, come forward in terms of helping the Burial Council in the process of preparing the Muslim deceased for burial, and in terms of ensuring that the washing procedure and the kafan is done to the best possible standards given the current circumstance and the situation. Now, inshallah, in today's video we're going to be covering how to prepare the Muslim deceased for burial, which will inshallah include how to don the PPE equipment, how to doff the PPE equipment, and how to wash the deceased and how to shroud the deceased to ensure that the last rites of the Muslim are met to the best possible standard. It's important that at this given time that we understand the importance of ghusl and we are able to offer these last rites in the best possible way. We have a responsibility of conducting things with jamal, with excellence, but at the same time we have a responsibility of due diligence and precaution and taking the necessary measures to ensure that everybody involved is safe and everybody involved is fulfilling the requirement which is necessary at the given time. Jazakumullah jaza.
Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Imran Khan. I am a local GP based in Huddersfield, and I'm going to start off by talking about the risk of COVID-19 virus being transmitted from a body of a deceased who is positive for COVID-19. Overall, I want to start by saying that the risk is very low. We know this because the World Health Organization has said in their report on handling COVID-19 deceased bodies is that up to the 24th of March there's been no reported cases of any transmission from handling a body that was positive for COVID-19. Also, the main route of transmission we know that for COVID-19 is through large air droplets, and obviously when you're dealing with someone who's deceased, they're no longer breathing, they're no longer able to cough or sneeze, therefore not able to generate large respiratory droplets. However, there is a possibility when aerosol generating procedures are carried out, these are not going to be carried out, and in terms of deceased, these are only carried out by pathologists performing autopsies and using tools, specifically power tools. The other thing is the World Health Organization and the UK government advise that body bags are not required for patients that are deceased from or who are positive for coronavirus. It does show that we can handle therefore the body and that it's not that much of a high risk that it can't be handled as long as appropriate precautions in terms of PPE are taken place. Also, the World Health Organization and the European Centre for Disease Prevention and Control, the ECDC, do advise that standard and non-invasive last offices body preparations such as combing the hair, washing the body, cutting the nails and shaving are possible, and they may be performed as long as appropriate PPE is applied. Again, it shows that they're not restricting us from doing ghusl, so ghusl is recommended. Now, although the risk is low, the risk is not an absolute zero risk. The main risk in terms of transmission is going to be by direct contact. We know the virus has been found in various bodily fluids such as respiratory droplets, respiratory secretions. These are secretions that come from the airway, and when you're dealing with the deceased, the airway is the mouth and the nose. It's also been found in fecal material, and it has been found in blood specimens, and that's something to note. Also, it can be present on surfaces, so the surface of the body. It can be present on the clothes, so possibly the clothes of the deceased as well. To mitigate that risk, we need to have a barrier between the person who is handling the body and the deceased themselves, and that is where your personal protection equipment, your PPE, comes into play. That is a physical barrier between yourself and the deceased, who is to all extents and purposes a risk for virus transmission.
Bismillah ar-Rahman ar-Rahim. So what we do have is there seems to be some kind of culture around panic and haste when it comes to dealing with Muslim deceased from or due to COVID-19. And there's a lot of talk about, rushing, panic, let's do it quickly, let's get to the cemetery, let's get it over and done with. And even the World Health Organization has made it clear that there's no need to hasten the disposal of a COVID-19 deceased. And even our deen, where there is reference, for example, in the narration of Abu Dawood, where the Nabi sallallahu alaihi wasallam mentioned with regards to the Sahabi Talha ibn Barra radiallahu anhu, who is ill, and Nabi sallallahu alaihi wasallam mentions to the Sahaba that he's close to leaving us, and when he does leave us, inform me. And when he does leave us, then we just need to ensure that the preparation for burial is done without any unnecessary delay. So where in our deen there is mention of being swift in the procedure, it talks about unnecessary delay, that there should be no unnecessary delay as opposed to panicking, rushing and compromising the dignity of the Muslim deceased. Another point of discussion is people are kind of in the passing having this conversation that it's a shaheed, so why is ghusl needed in the first place? Well, shaheed there are two types. One, you have the real sense of the shaheed, and one you have the constructive sense of the shaheed. The real shaheed is the one who died in military engagement, who died or was killed unjustly. And for this kind of level of shaheed, he has reward in the dunya in the sense that he doesn't need a ritual bath because his martyrdom is for him the ultimate level of purification. But he'll be shrouded and Salatul Janazah will be performed, and there'll be specific and high levels of reward for this person in the hereafter. And then Nabi sallallahu alaihi wasallam mentions over 40 categories of shaheed, which are known as the shaheed in the constructive sense, meaning that these are shaheeds who Nabi sallallahu alaihi wasallam has classified as shaheeds, that in this dunya though, they will be bathed and they will be shrouded and they will have Salatul Janazah, but in terms of the akhirah, they are shaheed, that they will enjoy similar merits and rewards as the first type of shaheed. Now, in terms of coming forward for the ghusl at this given time, it's very important that we take this responsibility. It's a fard kifaya, it's a communal obligation, and as far as we are possibly able to do so, we should try to bathe the deceased. Nabi sallallahu alaihi wasallam mentions in a hadith that a person who bathes the deceased is like his mother has given birth to him today. He's free of guna and free of sin. Whoever shrouds a Muslim brother, Allah subhanahu wa ta'ala will give him the garments of Jannah and will adorn him and dress him with the garments of Jannah. Now, in the given circumstance, as far as ghusl is concerned, the documentation, the Public Health of England, the World Health Organization, the relevant guidance that's out there, the public health authorities, and the scholars are saying that due to the risk being low, this does not compromise the fact that we should be not considering ghusl for the deceased. Yes, if somebody has health issues and doesn't meet the criteria, then they are not requested to come forward to bathe the deceased. If somebody is petrified and is scared and doesn't want to take the risk, then that's fine. But we do need volunteers and people to come forward and to take this responsibility, inshallah. And it's absolutely safe at this given time to do the ghusl in the sense that the risk is low. So there is a risk, but the risk is low. Now I just want to quote something from the ECDC guidance. Standard and non-invasive last officer's body preparations such as combing, cleaning and washing may be performed using appropriate standard precautions and PPE preventing transmission through direct contact. Minimum requirements include gloves and long-sleeved water-resistant gowns. So here there is mention of actually washing, combing, etc. being fine given the low risk. So when we have the guidance out there, when we have sound scientific research out there, it's something which the scholars do consider and will use as a basis before they give an opinion on a certain matter. And then there's also guidance with regards to washing and having a shower after the ghusl is performed. So once we have done the ghusl and the process is over, it's mustahab, it's preferred generally, and in the given circumstances, anybody who's currently involved in washing the deceased is strongly advised that they should have a shower or wash themselves down after they have washed the deceased. May Allah subhanahu wa ta'ala give us the understanding, inshallah. We will now move on to the procedure of donning the PPE and the safety measures that need to be in place, and then inshallah we'll talk you through the ghusl process, inshallah. Jazakallah.
So the next section we're going to talk about is protecting yourself, personal protective equipment, looking after yourself and those around you. So you have a responsibility to not just yourself. You have responsibility to yourself, your family, those people that are working around you and helping you in this process, and the Mayyit themselves. What is your job? Your job is to prepare the body for burial, whilst at the same time reducing the risk of virus transmission to yourself and your colleagues who are helping you there. How do we do this? Training, learning to wash our hands correctly, adequate personal protective equipment, as well as following agreed protocols. So we're going to move swiftly on to how to wash our hands. And the reason we mention this part and how to wash our hands is because whilst many of us wash our hands or multiple times a day, the normal process of it, we usually miss out vital parts which are inadequately washed. So we're going to go through the guidance on how to do this. This is available on various different media platforms, and various different organisations, including the NHS, have published it, and so has the UK government, and you may see this around. But we're going to teach you it again anyway. I would highly recommend at this stage you get a piece of a pen. We're going to write some numbers on your hand, and you do need to practice this before you come for a ghusl, because you're not going to remember how to do this. So I'm going to show you how to wash your hands. Now, you need to wash your hands at least for at least 20 seconds. You need to use warm water and soap. There are 7 different actions that need to take place to wash your hands adequately and to cover every part of your hand. What I'm going to ask you at this point is, if you get a pen, please, and I want you to write some numbers on your hand, and just watch me, and this is where you write them. So on your palm, I want you to write a number 1. On the back of your hand, just underneath your knuckle, I want you to write a number 2. Just at where the web space is, at your palm side, I want you to write number 3. And on the back of your fingers, number 4. On your thumb, number 5. On one of the fingertips, number 6. And on your wrist, number 7. So we've got palm, knuckle area, palm web space, back of the fingers, the thumb, the fingertip, and your wrist. Now I want you to remember that Surah Al-Fatiha has 7 verses, and to ensure that you wash your hands for 20 seconds, and that you don't miss an action, I want you to read 1 ayat for every time you wash one part of your hand. Okay? And if you read it steadily, you will complete it with a minimum time of 20 seconds. So if we start, so the first thing we do is Bismillahir Rahmanir Rahim, and we wet our hands and we apply soap. Alhamdulillahi Rabbil Alameen. We rub our palms on each other. Okay? Part 2. So, one palm area over the back of your hand and interlock your fingers. Ar-Rahman Ar-Rahim. Don't forget to do the other side, so both hands. And number 3, palm to palm. Maliki Yawmiddin. Both sides. And then the aim of this section, number 4, is what we're doing is we're wiping the backs of the fingers. Iyyaka na'budu wa iyyaka nasta'in. Number 5, your thumb. Ihdina as-sirat al-mustaqim. Number 6, your fingertips. Sirat al-ladina an'amta alayhim. Number 7, your wrists. غير المغضوب عليهم ولا الضالين. Ameen. And next, we dry our hands with a disposable paper towel. And that's your hands washed. This, like I said, you do need to practice at home a few times before you do your first ghusl to ensure your hands are washed adequately.
بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
So we're going to talk about personal protective equipment now, We're going to show you how to put it on or don it, and we're going to show you some of the equipment themselves. Now, to start with, when you enter the room, before you enter the room, you should have shoe covers on, so your shoes are protected from your splashes. So before you enter, make sure you have some shoe covers on. Personal protective equipment is for your personal protection. It's in the name. It's a barrier, like I said earlier, it's a barrier between you, a physical barrier between you and the deceased, who is possibly a carrier of the virus and may transmit it to you. So you need that physical barrier. It's for your own protection. So the personal protective equipment has a few different things. So it has a gown, a water repellent or water resistant gown, a fluid resistant surgical face mask, some goggles or a face shield to protect your eyes, and gloves. For extra precaution, we've got an apron to put on top of the gown as well. So we're going to show you how to put these on, and there's a specific order that they need to be put on. And we start with washing our hands. Number one, you need to wash your hands adequately, like we showed you earlier. Number two, anyone with long hair needs to tie it back. Number three, those with jewellery need to take the jewellery off. Okay. Then we've got these gowns. So there's two types of gowns. There's these overall type ones, and there's also the surgical ones. The surgical ones are open. You put your arms in them, and they have two laces at the back, one at the back and one at the neck side that need tying. These ones we're going to put on. So the gown goes on first. Now this gown has a hood, so we'll put the hood on. Some gowns will not have hoods, and you may be supplied with some head covers that you can put on separately. We'll put on the apron next. Over the neck, tie at the back. The surgical mask come next. The surgical mask has a flexible band at the top. It needs to cover from the bridge of your nose to just under your chin. And some have these that go around your ear, others have laces that need tying in two different places, one behind your head and one just at the top of your neck. So put these on. It needs to cover just under the chin and the bridge of your nose, and just press on the flexible band so it has a snug fit. Next to goggles. Again, goggles come in different types. These are ones that are like glasses. Others may have a band at the back, a flexible one, and if it does have that, ensure that it's tightened appropriately so it's comfortable. And likewise with your gloves, they do need to fit, not too small, not too big. And we're now ready and adequately prepared with adequate personal protective equipment to do the ghusl. Right, so just another thing I forgot to say. So, should have done this earlier, but put our head covering on when we put the gown on. And also for those people like myself who have a beard, we need to cover either beard with a beard cover, or we can add another surgical mask to your face that's just lower down. So, like that, pull it down there, the beard's covered, and you can tuck the beard right underneath it. You may realise that my goggles are slightly fogged up. Ideally these should be anti-fog goggles so you can see clearly. So we're going to cover certain principles during ghusl and certain things to avoid, and if we abide by these, the ghusl inshallah should be done very safely and in a timely and concise manner. So the first thing is, whilst you've got your PPE on, whilst you're doing ghusl, you should at all costs avoid touching your own face. That's number one. Number two, we want to avoid splashing any water. So that means not using a hose, using low pressure water, try not to use a shower head. A bucket and a jug will suffice, but even that, we want to gently pour the water so there's no splashbacks. Number 3, we want to avoid moving the body excessively. Number 4, try and avoid touching any bodily fluids. And the way we're going to do this is that we're going to put a mask on the mouth and the nose of the deceased. If not, a mask is not available, then you can place a cloth or a towel over the mouth and the nose. Where possible, if there is any bodily fluids that you see, try not to touch it. And if there's any medical tubing inserted into the deceased body that's still present, avoid disturbing it in any way to avoid any release of any bodily fluids. Do the process slowly, calmly and gently, and listen to the instructions of whoever's leading the ghusl, and if you're unsure about anything, please ask.
Bismillah ar-Rahman ar-Rahim. So alhamdulillah, we are now in the washing vicinity, in the mortuary. We are going to now inshallah begin with the washing of the deceased. So I've got my PPE equipment on. Just assume I've got the face mask on and the goggles on, but just for the sake of being able to communicate, I'm just going to leave them out for the time being. And inshallah, the volunteers that we have, and we do have volunteers, we're mindful of social distancing, so they're out of the sight of the camera for the time being. And just assume that the volunteers also have their full PPE equipment that is necessary for the given procedure. So if the body, for example, has come with a bag, the first job is going to be to ensure that the bag, the sealed bag, is opened carefully and sensibly. So what the first thing would be is, depending where the zip is, if the zip's on the front or zip's on the side, we will first of all, for example, let's just say example, the zip's on this side. So what we'll first of all do is, moving out of the way, just open the zip slightly to allow any odors, if there's been any body fluids that have gathered. Okay, so we're just keeping ourselves safe. So we just open the sealed bag gently and allow any odors to come out. Give that a few moments, and then what we will do is unzip the bag. So we're assuming now the zip's on this side. This is how we've kind of laid out this piece of cloth as an example. So we will now unzip the whole bag. But before we do that, we'll unzip according to necessary to ensure, first of all, that the face is exposed. So when we're exposing the face, what we're doing is we're ensuring here now that we cover the face and the nose with a mask. And before we do that, we can apply cotton wool into the nostrils, both nostrils, okay? And what we then do is ensure, so there's not much of a space in this dummy here, but assuming that the cotton wool's gone into the nostrils, and we've also got cotton wool that's placed into the mouth. Once we've done that, now ideally in this procedure, I shouldn't be leaning over the face, okay? So I should be stood back a little bit whilst I'm doing this, and then I'm placing the face mask with the blue section facing upwards around the deceased, so it goes behind the ears. So throughout the procedure, the face mask is resting on the face of the deceased like this throughout the procedure. And we're going to assume, because we haven't really got anywhere to tie this back, that the face mask is on the face of the deceased throughout the procedure of the ghusl. Okay? So once we've got the face mask over, the cotton wool in the necessary places, we will then begin to remove the bag. So the zip will be open. So once we've unzipped the whole bag, we're now going to start the procedure of ghusl. So we need to ensure that the satr is covered. So I'll call upon the volunteers who will come and just place a cloth on top of the body whilst I remove the top piece of the bag, and this will be done simultaneously just to ensure that the satr is covered at all times. So once we've removed the top piece of the bag, and this is keeping in mind, obviously a male body, the piece of cloth is long enough to ensure that the relevant part of the body is covered. We will then now remove the bag from underneath, so we'll have one person standing at the head side who will slightly just lift the head. I will then lift the body from this side, and we will have tilting very, very gently, and then we will rest the body. We will then lift from waist downwards and remove the cloth from underneath, ensuring at all times that movement is minimal of the deceased. And once we have removed the body bag, we will now look at proceeding with the ghusl process. Okay, inshallah, so now we're going to actually begin with the actual washing procedure. We first of all need to ensure we've got all the things that we have in place, okay? Now, when we remove the body bag, there's a chance that the deceased is in a hospital gown or his own clothing. So what you might need is a pair of scissors to hand, maybe a couple of volunteers, just to snip it from the sides and remove it again with minimal movement of the body and ensuring that the clothing is moved and disposed of immediately in the designated area. So once we have done this, we will now perform the ghusl. Now, generally speaking, in an ideal scenario, there'll be very much of a hands-on situation. You're really kind of rubbing the body down, and there's a sense of allowing the body to be purified in the sense of the clinical essence of the body being purified. This is why we do wudu. This is why there's istinja. This is why there's cleaning the teeth and the nostrils with cotton wool or something in a normal procedure. And it's also a spiritual journey in the sense of the deceased now being prepared to meet Allah subhanahu wa ta'ala. Okay, so but in this given situation, what we are going to do is trying to balance between that which is acceptable and allowing the dignity of the deceased to be upheld. Okay, so in terms of the first procedure, which is going to be the istinja. Now, the water that we're using, ideally, we should be using a bucket and a lota or a jug with it. Okay, and in terms of using things like a shower head or a hose, because of the force of the water, we want to be avoiding any splashback. We want to be avoiding any steam rising from the body also, so the water temperature needs to be lukewarm or not too hot. Okay, so the first thing we're going to do is we're going to do the istinja. Now, generally, like I said, the element of istinja and purification will be fairly hands-on. But in this given scenario, I've taken water from the bucket. After taking water, I will lift the cloth and I will pour the water from the top. I will pour the water once. I will get some more water and I will pour the water again. And here what we are ensuring is that the pouring of the water is to the level where a level of purity can be obtained in this given situation. Okay? If there is an opportunity, I can take water again and I can lift the cloth from the side and pour water from this angle, again to ensure that purity is obtained in the given circumstances. So the first thing that we will do is istinja. Once we have done the istinja, the second step now is to go through the procedure of wuzu. Now in istinja as well, there is a concept of just maybe slightly pressing onto the stomach, onto the tummy. Okay, but in this given situation, we're not going to do that. Okay, we're going to avoid pressing onto the body or lifting the body in such a manner that a lot of movement occurs. Okay, so in wudu, I will take water and I will first begin with washing both of the hands. So the hands will be exposed from the cloth. I will wash one hand. Okay, again, it's up to an individual. We can either just pour the water and avoid rubbing if we feel uncomfortable, or we can actually just gently rub the hand. So the right hand, I will then get water again, and I will now do the left hand, pouring water and just gently rubbing if comfortable. And then we will perform the wudu in the sense of first of all pouring water over the face. So you're pouring water over the face. We can just pour the water and not have no rubbing element. Okay, pour the water and the water will be poured over the mask. Okay, so the mask stays where it is and the water is poured over the mask. Okay, we'll then take water again. So we wash the face. We then wash the arms down, up just past the elbows. Again, pour in the water. Take water again onto the left hand side. We will again wash down the left arm as well up to the elbow. Then we will wet the hands with water. So we'll take water from the jug, pour on our hands, and then we will just do massa of the head. We'll then take water, and there's been more than one volunteer doing this. Okay, and we can have two volunteers simultaneously washing, and we will wash the right foot, pour the water, and then take water and pour on the left foot. So this is the way that we will do the wudu of the deceased. So istinja and wudu are the two next steps that we need to be mindful of. The next procedure now is the ghusl of the body. We've done the istinja, we've done the wudu, now we're going to be performing the ghusl. Now in terms of performing the ghusl, we will get water and we will pour water on the right hand side of the body first. Okay, so we'll lift the cloth and we begin to pour the body, making sure the satar and the awra is covered. Okay, and then we will take water again and rinse down the left side of the body. So water is being poured all over the body, ensuring all parts of the body are wet with water. Okay, so we've started on the right hand side, then the left hand side. We're going to pour water on the face and the head, making sure everything is wet. And also, very gently, we can pass water under the body. Generally, on the washing trays, they are designed in such a way that if water is made to be flowing from the head side, that the back is usually washed with the water. And if need be, the body can be just tilted slightly to ensure that the back of the deceased is wet. And that can be tilted from the right hand side slightly and the left slightly, or if the wash tray is designed in such a way, the water can be flown from the back, again avoiding too much pressure, avoiding any splashing, okay, and the body will be washed accordingly. So we've done the istinja, we've done the wudu, and we've rinsed the body for the first time. We will then get water again, and this time do istinja for the second time, ensuring that any secretions that may have come out are washed and the area is purified. Okay, and like I mentioned before, water can be poured from the top and water can be poured from the sides to ensure ultimate purity is obtained given the circumstances. We will then have water mixed with soap or something which is scented. Okay, we're not advising here that we rub the body down with soap or any other element. So we have the water mixed with some kind of scent or soap or something. And again, we now rinse the body down for the second time. Okay, and again, the bare minimal is that the body is rinsed once. Okay, and if we feel comfortable, then we can go the second time with the soaped water. And once we've done the body with the soaped water, which is basically the second rinse after the second istinja, the body is now ready basically to be dried. Okay, so the body has been now washed, the deceased is now washed. Now we'll ensure the body is going to be dried. Now in the drying process, you will have a towel to hand, and when drying the body, we are not going to wipe the body down or put any pressure on the towel. It's basically a dabbing process. So we will have the towel to hand and we will dab the body gently, the face, ensuring that the body is dried. Okay? Now, once we've dried the whole body, the chances are that this cloth now is going to be wet. And because we've chosen a thick piece of cloth, no element of the satar is visible, but because this piece of cloth is wet, it needs to be removed. So now we need the volunteers to come along, and what they will do is they will take a piece of cloth, so if I have the volunteers, so what we'll do now, exactly the same we did before. So we have another piece of cloth, okay, ideally cut to the relevant size, okay. I'm just using this as an example, okay. So if we just get hold of this gentleman, okay. So they will hold the cloth like this, okay, and one of us will just pull the cloth from underneath, and they will rest the cloth on top. And this way the soaked piece of cloth is taken away and is disposed of in the designated area. Now we have a dry piece of cloth on the deceased, okay, and the body has now been dried. And there may be an element of just revisiting drying the bottom part of the body on where the cloth was resting. So the volunteers have now finished from their duty at the moment. What we can now do is put on the attar. And this is again something which the Muslimin and the Tabi'een, and it's mentioned in the practice of the Sahaba that we should apply the perfume to the areas of sujood. So we will apply perfume on the forehead, we'll apply perfume on the elbows, we'll apply perfume on the just dabbing process on the knees, and we'll apply perfume and attar on on the feet. So the areas of the body and the limbs that would generally touch the floor in the posture of sujood are perfumed, okay, in this manner. So once the body is now perfumed, the body, alhamdulillah, in terms of the ghusl, the process is now complete. The next process now is going to be the process of shrouding and placing the body into the coffin. Okay, inshallah, so now that the body has been washed, we're now going to shroud the deceased. Ideally, we should have the coffin in the same room, brought into the same room in where the body has been washed. The coffin should be, and the shroud should be readily placed inside the coffin so that it allows for a swift transfer of the body into the coffin, and the coffin can then be, the shroud can be then put on appropriately, swiftly, without any delay. So this is where, we generally do need volunteers. Now, if the body is straightforward, mashallah, general normal weight, it's fine for volunteers. If the body is going to be slightly heavy, it's difficult to lift the body at this stage. So you might need the relevant volunteers to ensure that this process is done swiftly and adequately and with the dignity of the deceased in mind. Okay, so we will call upon the volunteers now. Okay, and we will have the volunteers standing in their appropriate positions. So we'll have two on this side, two of us in this side, and one just holding the head. And we will, on the count of three, we will lift the body gently into the coffin. So 1, 2, 3, we lift. Okay, fine. Okay. So once the body has now gone onto the trolley, so the coffin generally is on a trolley. We can now pull the trolley away. Okay, and once the trolley is pulled away, now obviously we're using a different platform here. So the volunteer, just give me a hand in just moving these tables back, this platform back a little bit. There we go. Okay, that's fine. Jazakallah. So now we have the coffin, which is pre-prepared and ready, and the first element of the coffin is the qamis. Okay, so as the qamis is taken down in this manner, so there's a cutting for the head, which is fine. Okay, you can have it the other way as well, where it's just placed over, but the qamis comes over, and whilst the qamis comes over, we can then now begin to remove the cloth from underneath, ensuring the sattar is covered at all times. Okay, and then this cloth is disposed of accordingly in the designated place. So that's the qamis that's come down. In a normal male body, this is normal procedure. You have 3 pieces of cloth. You have the qamis, the izar, and the lifafa. In the female coffin, there tends to be 5 pieces of cloth. You have the sina band and the scarf that goes on top as well. Okay, so in this given situation, we're dealing with, for example, a male coffin, and in the sisters and the female coffin, there's not much of a difference. It's just that the sina band needs to be placed. Either can be placed at this given stage, or it can be placed later. Okay, there's no strict, real, robust kind of procedure of how it needs to be done, so long as the deceased is shrouded appropriately. Okay, so once the qamis has gone down, we will then begin to bring the coffin from the side, and it will be brought inwards like this, and then from the other side, we will lean over and just get the other side of the coffin, and this will be brought over again. We'll fold it on top like this. Again, the third piece of cloth, and again this will be brought over with the utmost respect and dignity, and we will then ensure that this side is also the same. It's gathered in the middle more or less. Okay, now at this stage there is an option to remove the mask. Okay, so the mask can be removed at this given stage. Okay, so it's removed as the final thing, and then we are kind of covering the full body, and then you have your ties. So you will tie the body here. The coffin will be tied here. 1, And you've all already placed one in the middle. Okay? This one here, it generally sits in the middle. It's just slipped out, so I'll just pass that underneath if we can kind of just clean the gap there. We'll just lift it up. You got it? Yeah, and we'll just tie this here in the middle of the body. Okay? And then you've got the final one, which is the tie at the end. Okay? And again, we just adequately just, here we are, just tie here. So the body is now shrouded, alhamdulillah. It's in the coffin, because the shroud was in the coffin, and that makes the process much more swifter and much more easily to do with and to manage. The lid is then placed on top of the coffin. The coffin then should be cleaned down, disinfected. The whole area should be washed down in accordance to the regulation and the guidance that has been given to us. And in terms of ourselves, those people who have done the ghusl and performed the ghusl, we should ensure that our PPE equipment is removed as per the guidance that's been given. And also in terms of having a ghusl and shower ourselves, it's mustahab anyway in a normal circumstance. And in the given circumstance, because of the emphasis, anybody involved in the ghusl should go home and have a shower after they have bathed the deceased. The deceased is now ready to be taken to the cemetery, and the janazah will generally nowadays take place in the open cemetery with social distancing in mind. Generally, this is a very difficult position because the family is in self-isolation. People are relying on volunteers. Okay, so it's a very sensitive scenario and a very sensitive situation for a lot of family members, and they need consoling and comforting, and this can be done via the phone. The aziyat can be done via the phone. We can offer our support, we can offer our condolences, but we've got to ensure we abide by the guidance given as far as washing, shrouding and burial is concerned. May Allah subhanahu wa ta'ala accept this little demonstration from us, and may Allah subhanahu wa ta'ala lift this waba and bala amongst the ummah, and may Allah subhanahu wa ta'ala, all of those who are losing their lives in this difficult time, may Allah subhanahu wa ta'ala give them the highest levels of Jannatul Firdaus, and may Allah subhanahu wa ta'ala grant their families sabr jameel. Wa jazakum Allah hasan jazaa. Assalamu alaikum.
So now that you've completed the ghusl, we're going to show you how to take off your PPE or doff the PPE. So again, this needs to be done in a certain sequence. There are things that you need to remember before you start this. Now remember, this is no longer a clean PPE. The equipment that you're wearing is no longer sterile and is now contaminated. And the parts that are contaminated are the outside of your goggles, the outside of your face mask, the front of your gown, including the sleeves, and your gloves. So we need to take care when taking these off. One thing to remember is that during the stages of taking the PPE off, if your hands do get contaminated, before moving to the next stage, you need to wash your hands again. Okay? So we start our PPE, taking our PPE off by taking off our gloves. And when we're taking any parts of our PPE off, the aim is to reduce any skin touching with the PPE. So the way we do this is that with our gloved hand, pinch it at the wrist and peel it off inside out, the first glove, just like that. So it's coming off inside out, like that, and hold it in the gloved hand. With the ungloved hand, put your finger or your thumb underneath the glove at the wrist, and again peel it off inside out, covering the other glove. Just like that. And we then dispose of it in our bin. So the next part is taking off our goggles. Again, do remember that the goggles have on the outside, they're contaminated. So remove them, ensure you don't touch the outside of your goggles. Your goggles may be disposable, we throw them away. If they're not disposable and they're reusable, we put them in the designated place for our reusable equipment. The next part is your gown. So we're going to talk about two gowns, and we'll start off with this gown that I'm wearing. The first thing is the apron. So undo it from the back, undo it from the top, and move it apart. Bend it forward so the outside turns inwards, and pull it in the back. And again, with it being disposable, we can throw it in the designated bin. Our gown, like I said before, we need to get rid of it. We need to remove it by taking it off inside out, so we don't contaminate the area. So unzip it, and we're going to remove the shoulders first, inside out, and let it slide down, and then pull one arm out, pull the other one out, and let it roll down, inside out, take your feet out. There we go. Now the way this gown was designed was it's a bit difficult taking off without contaminating your hands, and like I said earlier, if your hands do get contaminated in between stages, so before I take my mask off, I need to go wash my hands again to make sure I don't contaminate my face. If my hands didn't get contaminated, I can just take off the mask. We come to the mask stage now, and like we said earlier, we keep reiterating this, so you do remember, you don't touch the outside of the mask or the areas that were contaminated. So remove the mask. I've got two on, so remove the first one. Again, pin it into the designated area. And the second one, without touching the outside, pin it into the designated area. Now that your PPE is off, you need to disinfect your hands again. So we go wash our hands in the same manner that we mentioned earlier.
So now that you've completed the ghusl and you've taken your PPE off and put it in its designated places, whether that's for reuse or for disposal, we need to clean the environment. So we need to put on some protective equipment again. So put some gloves on and an apron on. Use a disposable mop head, disposable cloth, or disposable paper towels. And the first part we need to do using the disposable cloth is cleaning any surfaces with warm soapy water. Once that is done, we need to now apply bleach to the place. If we use standard household bleach, which is approximately 5% sodium hypochlorite, we mix 1 part of the bleach with 49 parts of water and apply it to the surfaces and leave it for 1 minute at least. During this process, avoid splashing and spraying any water, and that should suffice with cleaning the environment. So in terms of disposing of any waste products, this includes any disposable PPE, any cleaning equipment that's disposable, any disposable equipment that was used for the ghusl, and possibly the body bag as well as the maid's clothing. What we want to do is carefully place it into a large bag, possibly a bin liner, and this large bag should then be tied. It should then be placed in another bag, so it's now double bagged, and we want to leave it in a secure location for at least 72 hours. Once 72 hours has passed, we're able to dispose of it in the usual community waste. So the last part is cleaning yourself, so which one Imran mentioned earlier, it's mustahab to have a shower, and in this stage it'd be ideal to have a shower anyway to get rid of any impurities that you may have come in contact with. Also in terms of laundry and cleaning any items that are reusable as well as your clothes, you need to take off all your clothes. If there's any clothing of the maid that needs giving back to the family as well, all of this should be put into a washing machine with standard household detergent that we normally use for washing clothes, and wash at a temperature of between 60 and 90 degrees Celsius. Before you do put it into the washing machine, and when you're handling any clothes, some of us have a habit of just shaking the clothes down a bit. You must not shake any clothing or any cloths before putting them into the washing machine or whilst handling them. And any items that are heavily soiled, especially with bodily fluids, for example, vomit, they should not be washed, they should be discarded completely. into the appropriate place, like mentioned earlier on.